Hi friends, I'm Dr. Mohammed. Thanks for watching. Now let's talk about Lexotanil tablet, uses, side effects and price in Pakistan. Lexotanil is a benzodiazepine medication used to treat anxiety disorders, seizures and insomnia. It works by enhancing the effects of the neurotransmitter GABA in the brain, which promotes relaxation and reduces anxiety. So what is the mechanism of action of Lexotanil? Lexotanil acts on the central nervous system by enhancing the effects of GABA. It binds to specific sites on GABA-A receptors in the brain, causing an increase in the opening of chloride ion channels. This results in the inhibition of nerve cell activity, leading to a calming effect that helps to alleviate anxiety, promote relaxation and induce sleep. Lexotanil comes in two strengths, 3 mg and 6 mg. Lexotanil 3 mg tablets price in Pakistan ranges between 70 and 90 rupees per 10 tablets. The Lexotanil tablet price varies depending on the strength and manufacturer. The Lexotanil tablet users include anxiety disorders. Lexotanil is commonly used to treat various types of anxiety disorders, including generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. It works by producing a calming effect on the brain, which helps to alleviate anxiety symptoms such as excessive worry, fear, and nervousness. Seizure disorders. Lexotanil may also be used to treat seizure disorders, which are sudden and uncontrolled electrical disturbances in the brain that can cause a variety of symptoms such as convulsions, loss of consciousness, and muscle spasm. It helps to reduce the activity of nerve cells in the brain, which can help to prevent seizures. It helps in insomnia. It may be used to treat insomnia, categorized by difficulty falling or staying asleep. It can help to induce sleep by producing calming effect on the brain and can also improve the quality and duration of sleep. Alcohol withdrawal symptoms. It can be used to treat the symptoms of alcohol withdrawal, which can include anxiety, tremors, seizures, and hallucinations. It works by reducing the activity of nerve cells in the brain, which can help to alleviate these symptoms and prevent seizures. Obsessive-compulsive disorder. Lexotanil may be used as a part of the treatment for obsessive-compulsive disorder, a condition characterized by recurrent, intrusive thoughts or compulsive behaviors. It can help to reduce anxiety and improve the symptoms of OCD, but should only be used under the guidance of a healthcare provider. So how to take the Lexotanil tablet? Follow these general instructions for taking a Lexotanil tablet. Take the medication exactly as prescribed by your healthcare provider. Do not take more or less than the recommended dose, and do not stop taking it suddenly without first consulting your healthcare provider. The dosage of Lexotanil will depend on several factors, including your age, medical history, and the condition being treated. Your healthcare provider will determine the appropriate dose for you. Lexotanil is usually taken orally with or without food. The tablet should be swallowed whole with a glass of water. Do not crush, chew, or break the tablets, as this can affect the way the medication is absorbed by the body. It is recommended to take Lexotanil at the same time each day to help maintain a consistent level of the medication in your system. This is the dosage of Lexotanil tablet. The recommended starting dose for adults with anxiety disorders is typically 3 mg per day, taken in divided doses. This may be increased gradually if needed up to a maximum dose of 30 mg per day. The recommended starting dose for adults with insomnia is typically 1.5 to 3 mg per day, taken at bedtime. This may be increased gradually if needed up to a maximum dose of 15 mg per day. The recommended starting dose for adults with seizure disorders is typically 6 to 12 mg per day, taken in divided doses. This may be increased gradually if needed up to a maximum dose of 60 mg per day. The recommended dosage for elderly patients or patients with liver or kidney problems may be lower than the standard dosage and should be determined by a healthcare provider. It is important to consult a doctor to determine the appropriate Lexotanil dosage for your specific needs. Here are some side effects of Lexotanil tablets. Drowsiness, fatigue, blurred vision, changes in appetite, decreased libido, skin rash or itching. More serious side effects of Lexotanil may include severe allergic reactions, depression or suicidal thoughts, memory loss or confusion, aggression or violent behavior, hallucinations or delusions, tremors or seizures, yellowing of the skin or eyes, irregular heartbeat or other cardiac problems. If you experience any of these serious side effects, seek medical attention immediately from a psychiatrist. The safety of Lexotanil during pregnancy has not been established, and it is generally not recommended for use in pregnant women. It is classified as a pregnancy category D medication. It means that there is a possible evidence of human fetal risk based on adverse reactions data from investigational or marketing experience or studies in humans. But the potential benefits of the drug may outweigh the risks. Regarding breastfeeding, Lexotanil is not recommended while breastfeeding because it can pass into breast milk and may cause harm to the nursing infant. Therefore, it is recommended that women who are breastfeeding should consult a gynecologist before taking Lexotanil. It normally takes about an hour for Bromazepam to start working. The effect may then develop over a number of days or weeks. Only use Lexotanil for a brief duration of time, for example 2 or 4 weeks. Long-term usage that is continuous is not advised unless prescribed by your doctor. I hope you like the video. Please like and share our channel, subscribe to our channel. Thank you.